My name is Catriona Shaughnessy. This is my final exam submission for Diagnostic Reasoning and Advanced Physical Assessment. Here's my photo ID, and I will show you my workspace. The chair and the couch will be my exam table. There's a blank piece of paper for the mini cog. This is the surrounding area. Okay. Hi Bob, my name is Catriona. I'm going to be your nurse practitioner today. We'll be doing a head-to-toe physical assessment, and there will be a few interactive activities to help me get some more information. Do you have any questions?
Nope.
No. Doing my hand hygiene. I'm going to start out by assessing your vitals. You can go ahead and put this thermometer in your mouth. I'm going to get your blood pressure. Slide your arm through. And I'll be using my watch just for time for heart rate and respiratory rate. Yep, just relax your arm on your leg. Patient's blood pressure is 116/78. Slide it in your mouth. Patient's temperature is 98.1. And just relax your knee. Patient's heart rate is 64 and respiratory rate is 16. So next we're going to move on to one of the interactive activities. Before we get started with that, can you tell me what the date is?
It's August 7th.
And then about what time is it?
It's about 9:30.
And where are we?
We're at my house.
And what brings you here to the clinic today?
I am getting a general assessment.
So patient is alert and oriented ×4. Next we are going to do the mini cog assessment. So I'll scoot this towards you a little bit. So to start off, I'm going to state 3 words. I want you to repeat the words after I say them and then do your best to remember them. So the words are banana, sunrise, chair.
Banana, sunrise, chair.
Perfect. Now on this paper, I would like you to draw a clock. Start off by placing the numbers, drawing a circle, and then placing the numbers where they are supposed to go. As the patient is drawing the clock, I'm assessing his general appearance. He appears at stated age. He is well nourished, well groomed, and is cooperative with the assessment. Next, I would like you to set the hands to 11:10. Perfect. And can you repeat the 3 words I asked you to remember?
Banana, sunrise, chair.
So patient receives a score of 5 out of 5 for the mini cog assessment. Next, I am going to move on to my head, eyes, ears, nose, and throat exam. I'm inspecting the patient's skin. He is appropriate coloring for ethnicity, pale pink, freckles on his face and chest, and his shoulders and neck. His skin is warm and dry to touch. I'm going to assess skin turgor, slight pinch, normal skin turgor, and no skin tenting. So after I've inspected the patient's distribution is normal for gender and age. I'm going to palpate your scalp, so I'm going to touch. Feeling for any masses. No masses. I'm assessing the TMJ. Open your mouth. Close. And no signs of TMJ dysfunction. Next, I'm going to assess the patient's nose. So go ahead and look at me. There's no deformity of the nose, and again, no lesions on the face. Next, I'm going to percuss your sinuses. Percussing the maxillary sinus. Percussing the frontal sinus. Any tenderness?
No.
Now I'm going to palpate the sinuses, so a little bit more pressure. Palpating the maxillary. Palpating the frontal. Any tenderness?
No.
Now I'm going to assess for nasal patency. So go ahead and occlude your right nostril. Exhale. And then the same thing, opposite side. So both nares are patent. Next, I am going to examine your nose. So go ahead and tilt your chin up. I'm going to put my hand on your face. Okay. Septum is continuous. You can look straight ahead. Terminates are appropriately pink. There is no drainage, no blockages, no polyps. Next, we're going to assess your sense of smell. So go ahead and close your eyes. I have 2 essential oils here, and you can plug off your left nostril. Now go ahead and inhale for me. What do you smell?
Peppermint.
Okay, now switch sides. Go ahead and inhale for me. What do you smell?
Orange.
Okay, cranial nerve 1 is intact. So I've completed my assessment of the nose. Now I'm going to move on to the eyes. So I'm starting off by inspecting the eyes. Sclera are white, conjunctiva are appropriately pink. I'm going to assess the extraocular muscles and assess for accommodation. Follow my finger, moving in the shape of an H. Up, down, coming to the middle, assessing for accommodation. Patient's eyes show accommodation. Now I'm going to assess the patient's pupil reaction. Okay, look straight ahead for me. Pupil reaction is brisk and equal. Cranial nerves 3, 4, and 6 are intact. Next, I'm going to complete my fundoscopic exam, so just look straight ahead. Red reflex is intact. Optic disc is creamy yellow, circular, no cupping, clear margins, no signs of retinal hemorrhages, exudates, or lesions. Perform the same exam on the opposite side. And again, optic disc is creamy yellow, circular, clear margins, no cupping, no evidence of retinal hemorrhages, lesions, or exudates. Thank you. Okay, next we are going to assess the patient's visual acuity. I have a Snellen eye chart set up 6 feet away from the patient. Now, go ahead and cover your right eye. And please read me the lowest line you're able to on the chart.
LTFPH.
Okay, go ahead and switch eyes. And again.
LTFPH.
And now look with both eyes.
LTFPH.
Okay, now I'm going to assess your peripheral vision. Look straight at me. And I'm going to bring my hand out with a certain number of fingers raised. Tell me how many fingers I have up. And look straight at me.
2.
Okay.
1.
Okay. So patient's visual acuity based on the Snellen chart is 20/20. Peripheral vision is intact. So cranial nerve 2 is intact. Now I'm moving on to the ears. Alright. So I'm going to start out by inspecting the ear. No deformities, no lesions. Palpating the tragus, any tenderness?
No.
Okay. Pulling the ear up and back. Tympanic membrane is pearly gray and semi-translucent. No signs of inflammation. And I'm repeating the same exam on this side. Okay. Inspecting the ear, palpating the tragus, any tenderness,
Nope.
no lesions or deformities. Okay. And the tympanic membrane is pearly gray, semi-translucent, and there is appropriate serum in the patient's ear. Next, we're going to do a series of hearing tests. We start out with the Weber test. We perform it on this side. Now tell me, do you hear this louder on the right, left, or in the middle?
In the middle.
Okay. Now the Renee test. I'm holding the tuning fork at the mastoid. Do you hear this sound louder here or here?
There.
Okay. Repeating the same exam on this side. Do you hear the sound louder here or here?
There.
Okay. No signs of sensorineural or conductive hearing loss. Now I'm going to perform the whisper test. So go ahead and cover your right ear, plug it off with your finger. I'm going to whisper a word and I want you to tell me what you hear, okay?
Baseball.
Okay. Now do the same thing on the opposite side. So yep, exclude that ear.
Soccer.
Patient passes his whisper test, and so cranial nerve 8 is intact. So next, I'm going to move on to the mouth. So I have my tongue blade. Go ahead and stick your tongue out for me. Cranial nerve 12 is intact. Now I'm going to depress your tongue, say ah. Okay, thank you. Uvula rises symmetrically. Pharynx, there's no erythema or lesions. The tongue is pink and moist. Stick your tongue out again. There are no lesions in the buccal areas. Look up for me. Soft palate is pink. Hard palate is pale pink. And teeth are white and evenly spaced. No evidence of caries. At this time, I'm going to defer the gag reflex, but I would use the gag reflex to serve cranial nerve 10, and since the uvula rose symmetrically, cranial nerve 9 is intact. Now I'm going to complete my cranial nerve assessments. Go ahead and chew for me, bite down like you were chewing. Yep, so the muscles of mastication are functioning appropriately. Now I'm going to assess the sensation that you feel in your face. So this is sharp, this is dull. I want you to tell me if you feel a sharp or dull sensation.
Sharp. Dull. Sharp. Dull.
Okay, so cranial nerve 5 is intact. Now we're going to assess the same thing in your extremities, so in your arms.
Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. Dull.
Okay, so patient shows appropriate differentiation between sharp and dull sensations throughout his extremities. So next, we're going to make some facial expressions. So go ahead and raise your eyebrows for me. Smile. Frown. Puff out your cheeks. Close your eyes. I'm going to put my hands on your face, and I want you to open your eyes against resistance. Cranial nerve 7 is intact. So next, we're going to assess cranial nerve 11. Turn against resistance towards my hand. Perfect. And to the other side. Perfect. Cranial nerve 11 is intact. And at this time, we've completed the assessment of all of the cranial nerves. Next, I'm going to move on to the neck. So I'm going to assess your trachea. Just look straight ahead for me. Okay, trachea is midline. I'm going to assess the thyroid. So go ahead and swallow for me. No swelling in the thyroid and no palpable nodules. Now I'm going to assess the cervical lymph nodes. I'm going to start with the postauricular, preauricular, submental, submandibular, time. +2 symmetrical. I'm going to auscultate for a crowded bruit. No brewery is auscultated. Okay, we're moving on to the chest. I am inspecting the chest. Shoulders are even height. Clavicles are the same height. Anterior, posterior diameter is appropriate. Lean forward for me. No abnormal curvature. I'm going to lift up your shirt. No deformity of the spine. You can sit back. I'm going to palpate. I'm palpating for any masses, any crepitus, and do you feel any pain with palpation?
No.
I'm going to palpate for the point of maximal impulse, mid-clavicular line. I am at the 5th intercostal space here, and that is the point of maximal impulse. I'm going to percuss. Appropriate dullness over the heart. No areas of hyperresonance or unexpected dullness that would signify consolidation. Go ahead and lean forward for me. I'm palpating the back. Again, feeling for any masses, any crepitus. Do you have any pain with palpation?
Nope.
Okay. Now I'm going to stand behind the patient. I'm assessing for tactile fremitus, say 99.
99.
And again, 99.
99.
Patient shows normal tactile fremitus. I'm assessing for thoracic expansion. Inhale. Exhale. Patient shows symmetrical thoracic expansion. You can sit back for me. Now I'm going to auscultate, starting with the trachea for bronchial breath sounds. Proceeding down through bronchovesicular to vesicular breath sounds. Listening to all lobes of the lungs. Deep breaths. Go ahead and raise this arm for me. Okay, lean forward. Same thing, just to keep breathing normally. And lift this arm up for me just a little bit. Okay, thank you. You can sit up. Lung sounds are clear and equal throughout. Now I'm going to listen to heart sounds. So I'm starting at the aortic valve, moving to pulmonic, Bird's point, tricuspid, and mitral. Normal S1, S2 throughout, no murmurs, rubs, or gallops, with regular rate and rhythm for his respirations. It is a regular rate, regular rhythm, and appropriate depth for his respirations. Okay, so now we're going to move over to the exam table, the couch. Complete my peripheral vascular assessment. So I'm partially blocking the patient's lower extremities, but I'm starting with the upper extremities. They're warm to touch, appropriate coloring, appropriate hair growth, feeling the radial pulses. They are +2 symmetrical. I'm going to inspect the fingers, no signs of cyanosis or clubbing. Brisk cap refill less than 2 seconds. And go ahead and bend your knees up for me just a little bit. Appropriate hair growth, warm to warm, cool in the lower extremities. No signs of edema, no lesions. And then I'm feeling the pedal pulses. They're +2 symmetrical. And the posterior tibial pulses, +2 symmetrical. You can lift your foot up. Assessing for capillary refill, brisk, less than 2 seconds. And again, no signs of cyanosis or clubbing. You can go ahead and extend your legs. Moving on to my abdominal assessment. I'm going to raise your shirt up. I'm inspecting the abdomen. There is no distension. This scar here, is that from an old surgery or injury? Injury. Is it causing you any problems in that area?
No.
No? Okay. I'm going to go ahead and auscultate, listening in all 4 quadrants, assessing for active bowel sounds. Active bowel sounds ×4. I'm going to listen over the abdominal aorta for a bruit. No bruit noted at the aorta. Listening for the renal arteries. No bruits noted at the renal arteries. Assessing for the iliac arteries. And no bruits noted. I'm going to percuss the abdomen, assessing for any areas of dullness or tenderness. Appropriate dullness at the costal margin, the right costal margin over the liver. Now I'm going to do light and deep palpation, feeling for any masses. Any pain with palpation?
Nope.
Lift your right arm up by your head. Inhale. Palpating for the liver at the costal margin. You can exhale and relax. Continue with light and deep palpation. No masses are palpated. Did you have any tenderness with palpation?
Nope.
Nope. Okay, now we're going to move on to the musculoskeletal assessment. We're going to start with the knees and hips, just since we're already lying down. For your left leg, I want you to keep your leg straight and lift your foot up. Okay, you can lower your leg. Now bring your knee to your chest, and you can extend. I'm assessing both the hip and the knee. Now I'm going to move your leg through those range of motions. For passive range of motion, okay, we're going to keep your knee bent. We're going to abduct your hip, and then abduct. All right, you can relax. And then we'll do the same thing on the opposite leg. So keeping your leg straight, lift it straight up. Assessing the hip joint, you can lower it, knee to chest. So that was active range of motion, now passive. Lowering knee to chest. Now we're going to do abduction. Abduction. Okay. So bilaterally for the hips and the knees, full range of motion. Did you have any pain with those movements?
No.
No? Okay, well you can go ahead and stand up. You can stand right there. All right. We're going to do a few more interactive exercises here. So we are going to assess your spine first, but first I'm going to inspect your muscle bulk, appropriate muscle bulk, and we'll do your gait. So go ahead and take a few steps forward for me. Normal gait. In normal posture. Go ahead and bring your feet together for me. Look straight ahead. Now close your eyes. Romberg is negative. Open your eyes. Stick your hands straight out in front. Turn your hands over so your thumbs are pointing out. Hold that for a second. Pronator drift is negative. You can bring your hands down to your sides. Now, to assess your spine. I'm going to have you touch your toes. Okay, stand up straight. Now I want you to bend to your left. So lateral left flexion, back to midline. Now bend to your right, back to midline. Full range of motion for the spine. Did you have any pain with those movements?
No.
Now we are going to assess your shoulders. So I want you to abduct your shoulders, so touch your hands over your head. Now abduct, bring your hands to your sides. Perfect. Place your hands behind your head like this for external rotation. Then bring your hands to your sides. Now I want you to scratch your back with your right arm. Perfect. Now the same thing for the other side. Perfect. Any pain with those movements?
No.
Full range of motion for the shoulders without pain. Now we're going to assess the elbows. I want you to flex your arms in like this. Extend. Now flex again against resistance. Okay. So biceps, strength score 5 of 5. Bilaterally, you can extend your arms. Now I want you to bring your hands facing out like this, like you're going to give someone a high five, and then go down. So triceps, and then bring your arms back up, and then push down. Perfect. Strength score of 5 bilaterally for the triceps. And then to further assess the range of motion for the elbows, stick your arms straight out in front, and I want you to pronate, stick your thumbs out, and then supinate. Okay, so you can rest your arms down for a second. Full flexion, extension, pronation, supination. So full range of motion for the elbows. Any pain with those movements? Nope. Arms straight out in front. So I want you to extend your wrists, flex your wrists. Any pain with those movements?
No.
Full range of motion for the wrists. So you can go ahead and sit down again. Okay. Now we are going to assess. I'm going to palpate your knees. Any pain or tenderness?
No.
No crepitus or swelling noted. I want you to point your toes up. Point your toes down. Okay. And then pull your toes up to the sky against resistance. Perfect. Push down. Okay. So we have full range of motion, ankle strength score of 5 bilaterally. And then now I'm going to assess your reflexes. So we're going to start with the patellar reflex. Are you able to see? Yep. Okay. +2 bilaterally. The Achilles. +2 bilaterally. Brachioradialis. Just relax your arm as much as you can. Okay. Okay. +2 bilaterally. Biceps. Just relax. I'm assessing them. I'm not only looking for movement, I'm looking at the muscle itself. Okay. +2 bilaterally. Triceps. Relax, relax. Triceps is +2 bilaterally. So now we've completed our head to toe assessment. Do you have any questions, Bob?
No.
No? Alright, thank you for being my patient.
Thanks.